Tell us about the recognition and management of diabetes associated with ICI therapy. In particular, can you comment on the recognition and management of itis in patients who already have type 2 diabetes? So when you institute ICI therapy, or any therapy for that point, you want to get a baseline of your patient's pre-existing illnesses and comorbidities. So for your patient that has type 2 diabetes, you want to know what their baseline glucose level is. You want to know what medications they're on. Oftentimes they're going to be on an oral glucose medication. We will be checking their glucose levels, fasting with each cycle for at least the first 12 weeks to determine that these patients have a stable glucose level. So for your patient that has a mild hyperglycemia, so that would be patients that are their glucose level would be under 200. Usually we just monitor them unless they're symptomatic. Most patients are asymptomatic if they have a relatively low elevation of their blood glucose. So once again, the global parameters around 200. You're going to individualize your patient and make sure that they're not having symptoms. So what are the symptoms to pay attention to? So we want to pay attention to symptoms that make us worry. So that would be something like diabetic ketoacidosis. So your patient that has an increase in urination, thirst, they're more sweaty or diaphoretic. These patients have nausea. This can be a potentially serious, especially if the glucose levels are over 200 and your patient is symptomatic. Sometimes these patients need to be hospitalized because this onset can be actually very rapid and very acute. So I have seen patients with their glucose levels over 500, and these patients need to be hospitalized and they will be started on insulin. Obviously, you're going to hold and discontinue the ICI therapy until the patient's glucose levels normalize. But it is important for your patient with the type 2 diabetes, they have a pre-existing risk. So we will be monitoring these glucose levels. And many of our patients will have mild elevations, but they're asymptomatic and they can continue with their ICI therapy without any intervention. But it is important to know that because it can be a rapid and an acute onset, that patients that have glucose levels over 200, that you intervene. Sometimes you want to hold and delay and maybe institute insulin on a sliding scale for those patients until their glucose levels get below 200.